Say welcome everybody to this strategic webinar of April 30th, which is a little bit different. And the reason why we're getting everyone together today is because we have an opportunity to present Helpful Village and in Madrid for an international contest. So this is basically the agenda for today's webinar. We want to basically give you a little bit of the context, what is happening, why were we invited to go to Madrid to speak about villages. Second, the reason why we put together this webinar is that we are delivering the presentation and I'm speaking in front of the jury, but I thought it would be great to get your input and ideas about how do you present villages and what are different tips and information or what you can share with us so that we can improve our own presentation when we're in Madrid. So your input is welcome. And then basically today in the webinar, first we start sharing what's happening in Madrid. Second, we have a couple of questions we would like to ask you so that you can help us shape our message. And then in the number four, we can show you what we have so far, basically what we're thinking to present in Madrid, and also seeking your feedback, things that you think work or don't work. So basically, this is a very collaborative webinar where we want to hear from you to help us prepare our presentation. But we'll start with the context information. So there is a Madrid contest. And the date is the May 12th. So basically, I need to do a presentation at the Reina Sofia Museum in Madrid, which I'm super excited about because it is one of the best museums in Madrid. Maybe you have been there, but it's basically where all the Spanish modern art is. So Picasso, Miró, Dalí, Guernica is there. So it's just a treat to be able to present that day in that building where I have never been before. This is also part of the context is that Helpful Village, how did we get there? Is that Helpful Village applied for this Fundación MAPFRE Social Innovation Award. So it's an international contest. There was an application form that we filled out. We sent, we just explained what we were doing. And then we were selected as one of the four global finalists in the competition. There is a project from Chile, the project from Spain, a project from Brazil, and we are representing the United States of America, which obviously is a little funny to me because I'm proud to represent the USA, but I'm also a Spanish citizen, so it's like it's kind of funny representation. There is more information about the contest we can share with you, but basically, Fundación MAPFRE is a 50-year-old foundation, and they have a website where they explain how the awards and the prizes work. And there is also the definition of what are the four other projects. This is what kind of information they put out there about what is it that Helpful Village is doing. But then there's also the three other projects. And then maybe one last word about the context is what is MAPFRE, which is the foundation that is organizing the contest. And MAPFRE is an insurance company that is the leading multinational insurance group in Latin America. So I'm not going to repeat the number of $1 billion that they do, but basically it's quite interesting that it's a Spanish insurance company, but obviously there's strong ties between Spain and Latin America, and it's the largest multinational insurance company in Latin America, and we're happy that they selected us. Uh, Now, why is it important? I think it's a great opportunity to increase awareness about the village movement. It's a great pleasure to be speaking about what villages do and how it is a most effective aging in place program. An opportunity to expand the village movement worldwide. So I know that there is it's a very well-known model here in the United States, but it would be interesting to see if and we have had some initial discussions and conversation to see if MAPFRE would be interested in becoming some sort of a partner, maybe to help supporting villages, maybe in the Spanish-speaking world, either in the US, where they have also a presence, or in Latin America or Europe or whatever. But basically, it's an interesting international projection. And then the third part here is that we need your help to shape our presentation. So this is where we move on. That's all for the context. I don't want to spend too much time explaining that. If you have any questions, I can obviously discuss about that. But basically, I want to come to the core of our webinar, which is basically listening to you. So we have a number of questions, and we wanted to ask you to help us with this messaging. So this is where you come into play. And I'm going to list the four or five questions that we would like to ask you. And I want to see if the bravest of you are ready to unmute themselves and share any of these questions with us. It would be a great pleasure. We can do two things: is share this with your own answer to these questions online, kind of interactively, unmuting and just speaking in front of the group. Or also you can use the chat if you want to share some of your answers on the chat. If you don't feel like speaking in front of everybody, you can also do that. But basically, I'm gonna do the kind of the quick list of the five questions, and then we go one by one. So our questions are first, what is the definition of a village? How would you, in your village, or how would you describe what a village is in a nutshell? Another question is, what services should the village offer? We know that villages do events and services, but beyond that, what should other villages do more things? Should we be doing phone check-ins? In your opinion, is it important that villages also offer, for example, I know some villages do emergency preparedness. I know some other villages offer a phone check-in system with this example of the retired nurses, which is something that an interesting project that happened in Sausalito, but basically having a description of what villages do that go beyond the obvious of events and services is something we would like to hear about. Either services that we're offering today or services that you think that villages should offer in the future. Another question is, what is the message? What message is the most effective to recruit your members? Because interesting that there is a definition of what a village is, but that doesn't mean necessarily that this is what is convincing your members to sign up as village members. And then last question is, what do villages need to reach the next level? So we wanted to put on screen all four questions to give you time to think about to the answer of any of these questions ahead of time. So now we're going to open up a next slide, and then we're just going to pause. I'm going to ask you if there is anyone ready to unmute and share their own definition. And then the whole point of this is basically that we can hear different perspectives and then help us pick different elements that are either in common or seem interesting to improve our own presentation for Madrid. So I'm hoping that we have some people that are brave enough to be the first ones to go in. And at this time, I would like to basically stop speaking. And if there is anybody in the room that is ready to share their definition of a village, so when we're going to Madrid, but these people there, they don't know what the village movement is, how would you define it to them in your own words, in the most effective way? So if we have somebody, I mean, the ideal way is that if we can have people raising their electronic hands, if you know how to do that on Zoom, it helps me because I can see the names of who can come in first. If you cannot raise your electronic hand, you can just speak up, unmute yourself and go for it. So I don't know if we have somebody that wants to go in first with a definition of a village.
I'll start.
Great. Gail,
So,
you can go for it.
I mean, my goodness, now I've been involved with villages since we were the second, Capitol Hill Village was the second in the country. So I would just say that the definition hasn't changed one bit from the very beginning. And the intent is that neighbors help neighbors to accomplish what they want to do for the rest of their lives.
I like it. Do we have a second? I agree, and I think there is multiple good definitions. I was wondering if somebody else wanted to come in. I'm just taking notes, whatever they want.
How come you're not using AI?
Because I'm not sure. I have an idea, obviously, and I have my own definition. But it's about how to expand that definition with other people's idea if they want.
I'll speak up. I
Thank you,
think
Gail.
it's,
Oh, Carol.
as Gail said, it's the group of neighbors helping neighbors.
Mhm.
And one of the most important things I feel our members value is the fact that they are able to remain independent.
Uh-huh.
They don't have to ask friends or relatives to help them. They're able to take care of it themselves and at a low cost, and they become part of a community rather than just calling a taxi to take them somewhere. It's more of a community.
Mhm. Yes, I agree, Carol, with that one. And I want to say this is very useful. I want to say also that maybe for some people in the group, this might seem like an unnecessary exercise because we all know what a village does. So for all of us, it's easy because when you're speaking, Carol, I say 100%. That is it. And Gail, when she spoke, is also 100% what is it. But the difficulty for me is how to explain that to a jury in Madrid that has no idea of what we're talking about, right? And then how to condense that in just 2 seconds in the most obvious way. So I think this is an exercise that can seem easy for us when you're talking to an expert, and we're all experts in villages, but it's a lot harder when we're explaining to a person that has no idea in a village in the context of this contest. And then Gail, I think you wanted to chip in also. Gail Brewer, you're muted.
Yes, I just wanted to say our definition is allows people to stay in their homes and still be involved in the community.
I'm writing that down. I like it. Involved.
We do a lot with emergency preparedness
Yes.
and healthcare advocacy.
Emergency. I'm writing that down. So if someone else wants to go in, we have Linda. Uh, uh, and I'm writing that down, Gail. So I like it. And I know I come back to you because for the what should villages do, I'm writing the two things you're saying about emergency preparedness and health advocacy.
I think to add to that, it changes the whole meaning of the concept of aging in place becomes living in place, so that people feel as though they're still vital and have value to the community.
I love that. Can I comment on that one? Because it's something that is interesting, and we see how this question is more interesting than it seems. Is that for us, we know about aging in place is totally fine. But I was speaking with some other people that didn't know what it was. I said, "Oh my God!" He said the word aging. The word
Yep.
aging.
Yeah,
If you put it in there,
it's offensive to a lot of people.
And I noticed when you explain it, right, that
Yeah.
that you say living in place. You know what? Another fun fact about this is that I was working, right? And for me, I teach at USC and I teach aging in place. So for me, aging in place is like something super important and vital. But then when I was translating into Spanish, right, for this contest, I translated it by living in place. Because in Spanish, it sounded a little weird to me to say aging in place because it's not, the concept does not exist. I just to coin it myself. And it felt better to me to say living in place, which was interesting. So I fully agree with your point.
Yep.
Christy, you want to come next?
Sure. I've got a multi-generational village. So we do take care of our aging members, but we
Yes.
also have are enlisting several volunteers and members who are not yet to the point where they need help.
Yes.
So we focus a lot on counteracting the epidemic of isolation and loneliness.
Mhm.
So we talk about a village as a community where neighbors interact to form relationships to take care of one another. And
Yes.
I was talking with another village leader here in Montgomery County, Maryland, that said they realized they had to use the word organization because they were getting confusion with some members who were thinking a village was like a senior home
Yeah.
or some type of assisted living facility. So they emphasize the fact that it's an organization, and we emphasize the fact that it's a way to build relationships and counteract loneliness.
Yes. I would say two things about that.
Everybody lives happier and healthier lives, including those seniors wishing to stay in their homes as long as possible.
Yes. I think that's super interesting. I agree with you. It's kind of a challenge, I think, with the word village. It's many times I have seen this question arising. It's like, well, is this some real estate development? Because there are many real estate developments that use the word village, because obviously it's a collection of houses. And then it is not. It's kind of interesting. In my presentation, oops, I got some echo. To Madrid, it was also focusing to clarify that from the beginning, right? Because I can get deeper into the concept, what it is, but I was like, no. The first thing that I want you to know is that people don't move out of where they currently live. It's not a concept where they need to move into some other place, like the same place. And that one is harder than it seems because we can get into, social connection, helping each other and stuff like that. And then people are still like, wait a minute. Are you a real estate kind of assisted living facility? And like, no, you missed the very first step. So I think what you said, Christy, is super important. I would also say maybe two other questions putting out there. I don't know if we have the answer, but it's kind of quite interesting how, we're talking about something important that can be talked about in the positives and in the negatives, right? And for example, when you mention social isolation and loneliness, it's very tough questions, very serious questions. It's a real problem, right? When I was in Berkeley, it helped me get the company started because I looked at the numbers, I looked how bad they were. I also imagined how bad would it be for my mom to not socialize with other people. She's in the countryside. So for me, it's like, yeah, that's a real problem. But it's kind of quite interesting how sometimes if we bring up kind of a negative term or a sad term, right, it can also alienate. Some people also say, well, like if you go to my mom, right, and you mention social isolation and loneliness, like say, go away. I don't want to hear about any of that because I have enough going on already, and I don't want to think of that.
Maybe you can use promote connectedness.
Yeah, exactly. I agree with you.
I like that point. It's better to state it positively.
It's interesting how we can say the same thing about connectedness. And interestingly for me, the same thing happens with kind of aging in place and kind of going to a nursing home. It's the exact same thing. If you go nursing home, which I use sometimes talking about my mom, she didn't want to go. But then if you want to convince someone and then you talk too much about the nursing home, it turns into a negative. And the same thing can be said on a positive with aging in place or aging at home, which is it captures the same issue basically, because if you're aging in place or aging in your own home, everyone understands that you're not aging somewhere else that is not your home. So that I found that interesting. I have another question for the audience. I've been interviewing with different villages. And something that is interesting, and I think we all know about this, is that there's tremendous value on this social connection that is being created, right? With create all these friendships and supportive community and things like that. And it is so important and so valuable that when you're in a village, you start thinking, wow, the best thing is this social component, events and services. I was speaking with a village that has been existent for about 15 years. And this person was saying, well, we're looking at our messaging because our members, what they really love is this socialization piece and building community piece, etc. And they are not as focused as around the aging in place piece that was a founding component for them when they started. He said the initial founders of the village, they were all about fiery passionate about we're going to achieve aging in place. And then he was saying, but they did a survey of their members, and what their members were saying was, well, we love the social piece, so maybe you should, in their branding, they were switching their branding from aging in place really to kind of more of socialization. And so I don't know if someone wants to comment on that. Judy, hi, good to see you. I don't know if you wanted to answer about that or something else, but
Yeah.
Okay.
Yeah, what I was going to say is that we definitely we've had people talking more about not leaving the neighborhood. And so the idea, I think what's happening is people are getting older and they're realizing that there are very real reasons why they may need to move out of their current home. What they don't want is to have to move out of the neighborhood, right? And so it's kind of a redefinition of aging in place to incorporate the community more broadly. And so we've had to really think about our advocacy as a village for supportive housing option and single level living options within the neighborhood. So that's just kind of a twist on that, and also the idea that we had to move away from the messaging that made people think, well, if they weren't committed to staying, that they couldn't be part of the village for as long as they were here. Right. So it was like, so really trying to get the message across that, you don't have to be committed to aging in your existing home to be part of the village activities and movement.
Yeah, I love that. I have been surprised sometimes because I also initially when I started was all about aging in your own home and kind of the enemy was this assisted living or nursing home because like but actually, I have seen some members that were with a village, right? And at one point, they moved into assisted living because they needed some of the services. In this particular case, without naming anybody, but it was a cooking thing. Like the person or the couple is like, I'm not into cooking anymore. I'm done with cooking, right? And suddenly, this wonderful assisted living facility offers this cooking and laundry and stuff like that. And just it is what was right. But the same person, what was interesting to me, that the same person that moved into assisted living that initially I took as a loss, right? Like, oh, defeat, fail, right? I know this person is a village member, wanted to be in their home initially, but now they moved in, we lost. And I was wrong because moved to assisted living, got the services with food and laundry and other services, but they're still village members. They go still to the village events and socialization, and they absolutely wanted to be village members regardless of where they were living. And I like that, connect that to the definition that Gail said. It's like maybe these neighbors are helping you accomplish whatever they want for the rest of their life. So basically, what was important is not really the place, right? But actually the freedom to carry the life the way you want it. And then basically it's like, okay, well, I'm assisted living, but I can still connect it to my friends. I'm still participating in the events because this is what I want, and the village allows me to do that. So basically, this freedom, right, of doing your life whatever you want is good. I want to share another example here that is a little shocking. Like I was speaking to some people in assisted living, and this person wanted to create a village inside the assisted living facility. And he was telling me how, I mean, there is good and bad, right? Assisted facilities, but also the resistance of some of the assisted living management to see them organize and gain power by, basically doing the life that they wanted. You see what I'm saying? Because in a way, it's a power thing to isolate people. You see what I'm saying? And not have them as a group. And basically, the village is this group of people that if we unite and work together, regardless of where they are, what basically forms a stronger community to live their lives the way they want it. So, Julia, I think you are saying something huge, which is like it's not the location only; it's about this freedom through the connection to other village members.
Can
So I
I
like
can I say something? Sorry, I don't know how to wave to
raise your
say I
hand.
want to raise your hand.
Shamiso,
My actual hand,
yes, but
or
you know what? Maybe Shamiso, how about we do the following? I think maybe
yeah,
Margaret had raised her electronic hand, so maybe we can have
okay.
her come in first and then you go second, if that's
I
okay.
don't know how to I don't know how to do the raise your hand electronically.
Yeah, there's something like reactions, and then in
Oh,
reactions,
I
raise your hand.
see. Okay. Okay.
But you don't
Thank
have to.
you.
Even if you don't find it, I'll bring you in. But I wanted to have Margaret that has been waiting with her hand raised first.
That's okay.
Okay, cool.
I think that it's important as we get older that we don't become dependent. We don't want to feel that our strengths are gone and we're weak again. I think part of it is helping them to improve the quality of life to keep as much independence as possible.
Yes.
Mm.
And
I
we've had the
like
same thing. We've had the same thing, Manuel. We're in the village of sister base, so we've had to emphasize that it's the village concept and explain what that is before we say we're part of the village of sister base. So I know what you're talking about.
Yeah, absolutely. And then just if I can comment a word on that, it's kind of also very interesting how the power of words and this subtle thing is because the word you said independence, and I see what you're saying, right? Which is this concept of doing the life, living my life the way I want to. But sometimes some people attack the term independence because you don't need to do it all by yourself, right? And in the village, kind of this kind of codependence or autonomy, which is like, okay, I don't do it alone because my mom cannot do it alone. She needs someone to go to the doctor with, but she's autonomous in the sense that, well, this is my life. I decide to put a service request and go with somebody else, right? But I have the autonomy to do it, not independently, because I do it with my friends, right? But I'm autonomous enough to do it, or codependent, which is kind of more technicism about we all depend about each other and we can all do that. But I like autonomy better than independence. But at the same time, saying that I understand 100% what you're saying, but it's kind of interesting how these little subtle kind of changes in words can be attacked by a jury or some other expert that's saying, "Oh, independence, that's not what it's not achievable or something." But I like autonomy and that is really important, that concept of independence. Like even sometimes say freedom, because I am autonomous or independent, I am free to do my life the way I want it, and nobody needs to put me in front of the TV when I don't want to do it, which I'm sure happens also in the worst case scenario. So this quest of independence, autonomy, or freedom is essential to the definition, in my opinion. So thank you, Margaret. I know Carol raised her hand, but I have Shamiso that had been waiting. So maybe Shamiso,
Oh,
what's coming next?
okay, sure. Maybe two things. So in our, we're still working our mission, I have to say, and trying to get it right. And part of, I mean, this is not part of the mission, but our impact, we say, we offer access to comprehensive practical services and foster social support and a sense of community. That's one side. But the other side, what you guys have been discussing, Manuel, especially you, is our village offers, practical services, but we also have a programming side piece, and we are actually working now to enrich the programming, because what we have found is that the initial members in our village have aged, and many of them are starting not to come to the programming just because of logistics and stuff like that. And then I think we are like in the process of making a decision to become a member, you had to be 60 years old or older, but we are now thinking 55. But now we are 55 years, but we are promoting this programming as much as all the other things that we've been doing.
Yes.
Does that
I
make
love
sense?
that, Shamiso. Yeah, that's great. But if I can also kind of comment on that one, it is also a challenge to me when I'm preparing this contest, because I know how important the events and programming is, right? But sometimes the challenge with the contest is that there are so many other people doing programming, right? I know there is a local church that is doing a programming, and the senior center does programming. So when you get in front of a jury, right, like in Madrid, it's like, well, it's like the best thing about us is that we have events and programs. And they can, it's like, oh, I know, my city does the events and programs with this senior center. They don't need this. And so it's a challenge, because I am with you. I think it's essential to villages. It gives tremendous value, the value of community to your members. So we need to absolutely do that. But it's kind of funny how sometimes it's hard to present it outwards to other people that are not members. In my feeling is that to members, like, well, events is magic. It's super fundamental and super important. But when you're recruiting other people, sometimes it's challenging to say, well, our focus and what we have that is unique, that nobody else is doing, that my local church is not doing, or the senior center is not doing, is that we are accomplishing these, living in your own house and basically building this autonomy and independence. So it's kind of funny how some component can be essential, like events and programming, but also how sometimes we need to kind of, not say it in the first two sentences when we're presented to somebody that doesn't know about it, because he's like, oh, well, events. Oh, I know these other groups that do events. It's one of 10 other organizations that does events. So it's a challenge. It breaks my brain in the sense that I don't want to say it's any less important, that programming and events is super important, but just for people that have never heard of it, you see what I'm saying, of the concept, I think sometimes it's easier to understand this message of autonomy or independence or aging in place or living in your own home, etc. But that can only be achieved if we have social events and socialization and programs. So it's kind of funny. It's a essential component, but it's hard to know when to mention it, in the contest. You see what I'm saying? I would be tempted more to say, okay, well, what is really unique and specific is to have this goal of doing this event, this aging in place through, and then with the through, now we have the events, programs, the services, and stuff like that. But it's just, I don't know, you know what I'm saying? It's a puzzle, just putting out there so that we can find the solution together. But thank you. I 100%. And the other thing that I like is like these comprehensive services, because if some people come thinking that it's all about services and the pure transactional aspect of it, I think they're entirely wrong. You see what I'm saying? That maybe home care can do that, etc. But villages bring you so much more. And then there are comprehensive services that other community members are happy to do for you, right? But with this other community building component. But 100%, I thank you, Shamiza. I 100% agree with you with the fact that events and programs are so important and essential. Carol, you wanted to add another thing there, I think.
Yeah, one of the things we ran into, our original name of the group was Portland Area Villages. And we had so much misconception about the fact that we were not a village of senior housing or senior living. So we changed our name. We had a group of people that were marketers that volunteered their time, and they came up with our new name, which is Independent Senior Network. And it shows that people get to be independent. It's the group of people that we work, and it is a network of volunteers and members. And everybody that heard the difference was thrilled with the new name, and it made a difference in how the whole community sees us. So I think getting the village name out of it, not necessarily completely go, because I love the village to village network, but make sure everyone knows that it's not a brick and mortar thing.
Yes. Yeah. I think this differentiation from the brick and mortar is super important and essential. I also like, Carol, that you have this kind of aspiration or this dream in the name, like independence. Like, okay, the reason why we get all these people together and why we do these events and programs and services, etc., is like because we want to reach this independence. And kind of that same dream comes with aging in place. Like, okay, that's the same. Aging in place also captures independence or autonomy, because in my house, I'm independent because in my house, my rules. That's what my mom would say. Perfect. I think we should move on to the next question, but I think we've got a lot of elements here on this one. This next one is, what services should Village offer? I would put out of the list the two obvious one, kind of events and programs. We should do them, and we're already doing them. And then there's also volunteer service requests. So those we are fundamental components. Gail added two others before: emergency preparedness and health advocacy. So maybe you can, so I would invite everybody in the room to think about other things that to extend that list, but maybe to give you a minute, we can start with Gail, if she's still around. You don't see her, but she's probably here. But Gail, if you can help us understand with this health advocacy, how would you define what type of services are you doing around the health advocacy, which, by the way, I'm super interested in, and I like the idea but maybe sharing a little bit more detail about how you envision it.
Okay, when people become members, we have a retired nurse who interviews them and sets up their vulnerability. And this is both for, could they, in an emergency, could they get out by themselves, and then also the health care. So we have most vulnerable is 1, moderately vulnerable is 2, and non-vulnerable is 3. And the ones become part of the healthcare advocacy. And they're assigned an advocate who calls them periodically to see if they need any services, if they need any errands done, how they're feeling. And this has worked out very well because, they develop a relationship with these people and often take them to the doctors who are available if they call them. And so that's worked out very well. And then you've heard all about our emergency preparedness situation. And we have a lady who put videos together on what 10 things would you take if you only had 10 minutes to evacuate. And we've had drills on that. And everybody has their 10 and 10 list. And then we'll have a Zoom and we'll say, all right, the 10 minutes starts now. And you run around and get all these things and put them in your go bag. So that has worked out very well. And we have divided Sausalito into 10 neighborhoods. And every neighborhood has a captain and is aware of all their members, and they have functions together. So
yeah.
And the function that we started last year was the Super Monday. The first Monday of every month, we have a lunch. And Tricia has gone to all the restaurants in Sausalito, and they take turns providing the soup. And this summer, we're going to expand it to sandwiches or salads or something in the summer months.
And then this food that is then delivered to the member's house?
No, no.
At the restaurant.
We meet at the Episcopal Hall. They
Okay.
let us use their hall every Monday.
Yeah.
And we meet there, and it's donations are accepted, but there's no charge. You just have to sign up. And we have volunteers who pick up the soup from the restaurant and the tables. We have tables of 8 that are all set up with tablecloths and china bowls and everything. And that has worked out very well. We get about 60 people to that, and that's open to everyone in Sausalito over 60.
Yep.
And
I love it. It sounds great.
yeah.
Mm.
So, and we're going to start having teas in the mid-afternoon and just things to get people out about. And we're fortunate Sausalito has the CARS program, Call a Ride for Sausalito seniors. And you can call and schedule rides with them anywhere in Sausalito.
That's awesome. I like that. Sounds great. And obviously, I think all we're saying is how all these different services that Village offers connect with the definition that we were saying before. We're talking about independence, autonomy. Also, it's like, well, obviously there was this terrific time about the California fires and then power outages. Well, guess what? If there's a power outage, even in that case, Sausalito Village, I know, and other villages too, well, they have a plan. Like, well, fire department is busy with the fire, but we're taking care of our members, even in this particular case, because we set up this emergency preparedness plan. So that's pretty cool. I mean, it's pretty cool that it's a service that could be done in other villages. Also, it's cool how shows the creativity of villages about, well, we have this mission, right, this goal, and then it can be implemented in different ways. And this is one good example. So that's cool. Christy, you wanted to add another thing there.
I was just going to say another thing that our village does in addition to events and services are interest groups, providing opportunities for people to make friends that have things in common, whether it's a peer group or a hobby group, just a variety of social groups, interest groups.
I like that a lot too.
Yeah, we have a couple of book clubs. One where you all read the same book and another one where you all read a different book and talk about it.
That's cool. Judy, you want to add there too?
I'm just going to add, and I sort of referred to this earlier, but we also have advocacy when our village notices something that's going on in the community that requires attention. There's a group that gets together and, responds to that and gets people involved and creates talking points and does all that sort of stuff that you need to do for advocacy. And I think that's a really powerful thing that, because it benefits the members of the village as well as the community at large. So just as an example, we're doing, sidewalk safety. Most of our members walk. If they're able, they like to walk around the neighborhood. It's one of the things that makes living here so great. But we have brick sidewalks and people fall and they hurt themselves. And, there's a whole sort of political financial piece to that. So, people have really dug in. And I think that that's something that, that makes a village special, is that people can decide to do that. They have a way to communicate with others and kind of build whatever movement in a way that they want to build.
Yes. No, I like that. And there's another piece that I also was not obviously immediate to me, but kind of the possibility to provide training. I teach this class at USC that is about aging in place, right? As you know. And then I also learned some facts. One of the facts is that many times kind of falling, it stops you from aging in place. But then, if I had my mom, I wouldn't be able to send her to a fall prevention class in general, right? If she had to go to the senior center, she doesn't want to go to the senior center. If it was for a fall prevention, it's kind of a double no. She would never go. But then because we do this within the village setting, right? Like, hey, because it's the positive goal of aging in place. And hey, there is something about healthy aging that you should know. And we have this particular thing. I think it's a lot more possible to have our members attending and getting some health information or advocacy or any other things, because in this context, that is a much more social context. Also, de-dramatizes the aspect of, God, going to the hospital, because the hospital is going to tell us how how falls are so bad, how 100 people get injured. In that negative setting, my mom would just not go. But if we put it in a positive social setting in the village, like, hey, this is a healthy aging habit. You should know that, with these little things, kind of. And sometimes you have lights that turn on by themselves at night, right? It's like just motion sensor lights, like just little things, and then something like that. It can help you stay in your house longer because that's the goal of the village. That just huge if we can distribute that information sometimes.
I think it's also, I don't know if people have said this, I came a little bit late, but this idea of really having purpose,
Oh,
and whatever that purpose, having a, like I think of our village in a way as facilitating
mhm.
people realizing their purpose,
Oh yeah,
and for some people, their purpose is to lead. They want to lead a group or they want to
yeah,
lead an activity or they want, for
yes,
others, it's this public policy piece that they want to get involved in. And it's the
uh,
idea of helping to identify and help people manifest their purpose,
yes,
whatever that looks like. And, for some,
yeah,
it's helping run the village,
yes,
that gives meaning to their life or
yes.
helping a neighbor. It's sort of this very,
Oh yeah.
purpose is so important to all of us. And the idea that we're doing it in the context of peers.
Mhm,
You're not
yes.
being told by some little whippersnapper at the health clinic, you
Mhm,
need to get more involved in your community,
mhm.
or something
No,
like that.
absolutely.
It's, I think that idea of purpose is really important. And I think that is also when I think about that, I think, we try to encourage all of our members to think of themselves as givers as well as receivers.
Mhm,
Right?
mhm.
This idea that, just because you need help doesn't mean that you're not capable of
Uh-huh,
also giving help
uh-huh.
in different ways. And I think that idea that we are all capable of giving and receiving,
Yeah.
that there's no shame in needing help,
Mhm,
and that we all have something to offer. And so that's another way of sort of keeping, I don't know, keeping that sense of independence, as, but also that sense of purpose,
mhm.
that we all have something to give.
Oh yeah, purpose central to me, a big time. 100%. Sometimes you might remember this from conversation with me about me trying to have my mom stop working on the fields, right? She said, "No, I don't want to stop working because I'm not gonna be at home doing nothing." And it's like, "Oh God, you're so right." It's like, I mean, there's nothing. I mean, she preferred having her knees hurting rather than have no purpose, and then I don't know what to do, and that was horrible. And then obviously through the village have this beautiful immediate purpose of, well, helping your other neighbors achieve this goal of aging in place, and then also many different purposes, as you just said. Some people are like, I'm into organizing, right? Like I want to get together to want to put a proposal to city hall because we need to let them know about this. And then some other people are like, no, I'm not involved in politics, but there's this party, I need to move a few chairs and move a few chairs. So that's beautiful how it offers the opportunity to have this purpose for many different people in different ways. So I think your purpose is capital letters goes in there. Mm. Cool. Christy, you have a question asked, but I'm going to move my slides because I know the hour is running, but you can still come in. What is the next one? Oh, this one, I don't know if we have time for this one, but yeah, Christy, come in. I'll put this one and then, but Christy, come in with whatever you had, and then we'll move on to see if we can have one or two comments about this one.
I was going to just jump off of the purpose idea. That's one of our that's part of our mission, and
Yes.
we really hit hard with the volunteers. There's a book I love called Wonder Drug, written by two doctors, and they talk about it's a study. It's a compilation of all the studies that have ever been done on compassion and helping other people.
Mhm.
They give 7 scientific reasons why volunteering your time to help other people
Mhm.
benefits the giver as much, if not more,
Uh-huh.
than the receiver. So we
Oh,
talk
yeah.
about volunteering is also something you do for yourself.
Yes.
And we've been encouraging, we've started with volunteers. We just trained volunteers. We're starting membership sign up tomorrow. But I've got a few 80-year-old volunteers who are saying, I don't want help. And I'm probably, I probably can't do anything, but they were so excited when they found out, through the list of different types of ways to help people that they can help too. So
Yeah.
it's really has energized people, that sense of purpose.
Absolutely. I agree with that. That even sometimes we tend to think about, oh, well, the members are those receiving the service. It's only good for you, a village, if you receive something, kind of a transactional service of transportation. I absolutely with you, 100%. It's like, no, my mom is healthier because she's volunteering for other people getting out of the house and feeling appreciated, and it's tremendous value for the volunteer for this contribution that they're doing. There is another thing that is interesting also is that for some people, because we have kind of actually this previous question, how do you recruit your members? Like a person like my mom, if you go to her saying, "Well, mom, there's this organization you get services from," and she would say, "No, I don't need anything. I'm totally fine. So, I'm not interested in what you're saying." She would come in more easily if I say, "Hey, there's other people in the community, right? They want to be in their own homes, but they cannot do it by themselves. They need a little bit of help and assistance, and I'm sure you could help her." And she would be volunteer for that. She would say, "Okay, sign me up because I don't want to be told that I need help, but if you tell me some other people need help, I'll go there and help her." But guess what? When she's helping another person that's exactly like her, see what I'm saying? It's a totally perfect, fine lady or gentleman, and suddenly you're volunteering and goes one way, and I'm helping her. Like, wait a minute, how about how about reciprocity? It's just so natural, right? So that you can become member. You don't need to become a member from day one. You can start volunteering for some people, right? And then suddenly it's like, well, guess what? It's totally fine. You just met these members. They are not, these people that are, in some other terrible place. They are people just like me. And sometimes they take this a little help or assistance, and it's totally fine. And guess what? I also should be a member because they are people that are just fine like me, and it's totally okay. I helped. I did the three other things for them. Just happen not to be very good at this particular thing. Like my mom cannot go to the doctor, she knows it. Like, okay, well, maybe for that little thing, I'll ask for that assistance. So for me, yeah, being village member, sometimes we call it members because members are at the core of the system, right? But it goes beyond the just receiving. It's a lot about giving too. I'm 100%. This is perfect. Can we move on to this other? I think this is the last question, and then I have basically, if you're interested in kind of show you a little bit of the slides I had for the presentation in Madrid, maybe hopefully can capture some of the ideas we had, and then obviously I can refine it with some of the input I received today. But maybe do we have anybody that can come in here about what do villages need to reach the next level? I'm going in front of this foundation and then presenting, well, this is a beautiful concept that is in existence for the last 20 or 25 years, and then we do this that is wonderful, etc. But basically the question is, well, then why have if I'm in Madrid, why have we never heard of it in Madrid? See what I'm saying? If it's so wonderful everything you're saying, what had been missing? So I don't know. Maybe there are different questions here about what can we tell the foundation would be great to have so that villages become just an obvious concept that everyone knows in the US and worldwide about this is the real deal in the world of aging. What do you think this could be, Christy?
I think one of the things that's made it more obvious to the community that I work with, we've talked about how it's kind of going back to the way life used to be, not just pre-COVID, but pre-internet, connected devices, how you used to know your neighbors. It's, in the lesser developed places in the world, they still have that village community where you take care of everyone. And it's not necessarily something new, but we're just trying to get people back to the way it was when you knew your neighbors and everybody looked out for one another.
Yeah. So if I understand, you're saying that it's about framing, it's understanding that this is so natural, this is how it always was supposed to be, and then somehow we got away from the rule because modern way of life, and then just got more individualistic or something. But this is kind of something we need to go back to. The framing is in the message. Cool.
Yes, because I think everybody can relate to how society has become more about
Yeah.
staying to yourself and on your devices and not interacting, not physically connecting with other people anymore. And I think audiences will appreciate that.
Okay, cool. I like it. Gail, do you want to go next?
Yes, we partner with a lot of other organizations in Sausalito. We have these lunches the first Monday of every month, and someone from the police department always comes and helps serve. And it's just the idea of getting everyone involved. We partner with the churches. They let us use their halls. I mean, the Episcopal Church has a beautiful hall with a stage. We have a lot of functions there, and they let us use it every Monday, and once a month we give them a small donation for that. There's a women's club. The Sausalito Women's Club is very active. They do a lot of plays and things, and we partner with them. And I think it's just important. The Chamber of Commerce, we're having an event with them next month, and it's just a way to get our message out and to make sure everyone is involved in that.
Cool.
When there was an election, we had the Presbyterian minister interviewed all the candidates that were running for the election. And then we had the soup lunch the next day, and several of the candidates came and poured water and helped serve, and just a way to get everyone involved together.
Yep. So partnerships. Okay, that's a
Right.
good one. Great. I like it. Thank you, Gail. And Judy?
I'm going to be crass and say an infusion of capital. I don't know how many villages among us have much of a marketing budget. I know ours is small. We are taught as nonprofits that marketing is not a valid thing to spend on, right? I'm giving you money to provide services, not to do, advertising. And I think that a lot of people simply don't know about villages. And then when you think about starting villages and the fact that, the villages, the villages that started first, grew up in places where people had some independent wealth and had the time and the money to jumpstart these things. I don't think that should be necessary anymore, and it's not necessary everywhere. But what we're seeing, takes a year or two to get a village started, and where are you going to get the support to do that? Not everybody has that, and so we really do need an infusion of capital into this system.
Yeah.
Because otherwise we're all sort of clamoring for money to come from, government and healthcare systems, and they're asking us for things that a lot of us don't want to give. I don't want to give away the data about my members. They don't want me to. I don't want to have to track everything in this system and that system because they don't want me to. And so the only way that we retain our independence is to have an infusion of capital separate from those institutions that allow us to retain our independence and our creativity and our ability to innovate, and be able to tell the world about it. So that's what I would say.
Yeah, I thank you, Judy. I think you're absolutely right. I want to thank you also because also something that is not easy to say, but money also is part of the equation and an essential part of it. I also think that too, and there is a ton of money also. Sometimes it's also painful for us in the movement where basically, and I teach this at the University of Southern California, and I have all my students that is a master's program. They're all working on all these programs that are funded with funds that come either from federal funds or Older Americans Act, and so there's plenty of funding available, and then we are somehow operating and doing all the magic that villages do, self-funded based on membership dues, etc. So that feels a little bit surprising in a way. One, as you all know, this makes me happy, just my personal minute. I am super interested in saying, well, we should put that money into the most effective aging program. This is something also that I want to say in Madrid, is that because this is super effective in terms of the contribution of volunteers, how much they get done, how much village members are healthier because they don't get sick, they're purposeful, engaged, and socially active, and all of that is like, well, then if this is the best aging program there can be and the most effective one, then this is where the money should go. And then obviously, in my mind, this is why I was saying it's my minute, in the sense that it's not only a claim that we can make, like saying, well, we're the most effective because we say so. It's like something we need to prove scientifically, and this can only be done through data. It's kind of funny. We didn't plan for this, Judy, but it also seems like like it was scripted. But basically, a project like the taxonomy project that Capitol Hill Village and Helpful Village started saying, well, can we just show the numbers, right, so that we can go back to these funding institutions, either county or the state or federal, or even donors or anything like that. It's like we are making the claim officially as scientifically that this is a super effective program that should be better funded. So we almost went the hour without mentioning data, but I think it also connects to the fact that, hey, we can do this advocacy for additional funding for villages if we can provide this proof, and the proof can only come through data too. So that's cool. I like it. Barbara, you want to come in next?
Sure. Judy, I totally agree with you also. The infusion of money is incredibly important. I want to chirp on, I too was at ASA last week, and we are finally being recognized as an aging partner with a lot of it, but I think it really depends on our villages to do more advocacy, whether it's state, local, federal, and on OAA money. We are looking at, some serious cuts, and as a community-based organizations, I think we are at a pivotal time where we can show our strength in what we do. And, I wish we had 1,000 villages across the country. And I wish we could cut that time in half. I was on a call today with a village or a potential community because their hospital systems closing down in Pennsylvania, and they're scrambling. So it's just important that we continue to get the word out to do it locally. I mean, I look at, DC, has always been a great leader in trying to secure funds, but now we have the Virginia contingency and Village Movement California, and getting on the master plans and getting our names out there to show how strong community-based organizations in light of this administration right now, and because of it. So that's all I wanted to chirp in.
Well, thank you. Well, maybe one way to get our word out there is that I'll try to go to Madrid, get the word out to Madrid. And I wanted to thank you all for your input, because basically it's quite interesting. I think it's important to raise awareness about what the village model is, about all the great work that you're doing. It's kind of also interesting to me how after an hour, right, we have best experts in the village model today. We are all together and we're all thinking together about to explain this. And it's not that simple. It's kind of funny because it's so many dimensions, right? So many little magic things that do the village, the purpose component, the aging in place, the independence, the autonomy. So that it's super hard to get away from this laundry list of things that we do, right? Like, we do many different things. So kind of these messy organizations that do a little bit of everything. And it's not true. We are super effective organizations that we all share this goal of helping older adults maintain their independence, aging at home, or with some subtle differences. But it's super interesting to me how part of it is like, well, we need to raise our voices, but the message is something we need to work on collectively to say, okay, everything we said in an hour, I have 3 minutes in Madrid. So I have to condense all of that. Maybe we just need to repeat and say it with our different words in different settings, etc. But it's kind of super interesting to me how this is magic, and it's a tough job sometimes to condense it in just one little tiny package that can be easily understandable by someone that has never heard of it. But I think maybe Judy, I know you raised your hand. I'm gonna come back to you, but maybe one last piece that I wanted to say is that sometimes I'm an optimistic person. And I'm like, well, this can be explained. We can find a better way to put these words together so that we explain in 2 minutes and it's obvious to everybody. And sometimes I'm discouraged, and I think, well, maybe that's not possible because there's so many complex, rich social interactions in this rich social construct that maybe our biggest strength is that we are doing this as a movement collectively, right? And then basically going back to Madrid, say, hey, this is the definition, 40,000 feet definition, what it is. And guess what? There is 40,000 older adults in America that are figuring this out, and they're excited about what they do. And sometimes even just the sheer numbers of the movement, I think is what's also our strength. Judy, you wanted to add something there.
One thing that I've put in a slideshow for when I've been invited to teach a class, in one of the universities nearby, is just a slide that says, "Here's what we do," and it's like a list of, we provide rides to this, we do that, we match people for friendly visits, we do it. Here's what we really do, right? So in 2 slides, it's kind of like, here's the sort of micro, right? And here's the macro. We're building community, we're creating resilience, we're preventing loneliness, and so I think, I don't know, I found that to be sort of an effective way of getting across. I just wanted to share that.
I like it. I like that too. I think we need both. It's kind of funny because sometimes I have gone into presentation giving the high level concept, right? That is beautiful, right? With purpose, autonomy, and socialization. But then people are like, okay, well, yeah, that's beautiful, but you don't see how it works. You see, everyone claims that. Kind of my church also says autonomy, community, whatever. So it's kind of like any other thing. And then you need to do a little bit of both. You need to be the beautiful, big level concept. And at the same time, but at the same time, we do this. And because we do these 10 things for my mom can stay in her own home. And she couldn't if we didn't do that. So it's super interesting. Christy, you want to come in?
I liked your idea of talking about how the movement has spread, and you might want to use some sort of graphic. Maybe you have Beacon Hill, the first people, and just give a quick story about what happened to these people, and then show the graphic of how the movement has spread across the country to show that it does have enough value. And then they'll tune in to really hear the what does it do. But I think that's powerful to see physically how it's spread.
Yes. Absolutely. I think that's an absolute requirement to have, okay, this is the concept and this is a reality. It's not a utopia of neighbors, everyone helping everyone, like it's a summer of love, but it's like, this is very real. And we have all these organizations with concrete operations and services that happen in all of these places. So those numbers in aggregate, that's also why the taxonomy project is also so important. It's like saying, okay, it's not just, the general words, like, okay, I'm telling you, 40,000 members, 200,000 service requests. So that brings you down to this level of, well, this is very concrete and very real too. Anyways, this is perfect. I'm sorry because we are going past the hour. It's 12:06 and I'm sure you have very busy days, etc. So I think we should stop there. But before we do that, I wanted to thank you all because it's a kind of overwhelming mission to do that, kind of summarize the whole thing. And with all these input and ideas, it feels a lot better. And I'll try to do my best to translate all of this into Spanish and then present in Madrid and then hopefully come back with good news. We would be super happy to share whatever happens there with the group. Thank you, everybody. Have a great day. Bye-bye.
Thank you, everybody. Bye.
Thank you.